Hello, everyone, and welcome to this webinar titled Addressing COVID Vaccination Challenges with Employees. It's a very hot topic, we know. My name's Marianne Broadbent, and I'm an NGS Global Managing Partner based in Melbourne, Australia. And we welcome over 120 registrants across the Asia Pacific in this session today. NGS Global is an executive search and leadership advisory firm with more than 30 offices worldwide, and 12 of those are across the Asia Pacific, so we're very well represented. We're very proud to be sharing this timely session with you today and trust that it will be of real value. A little bit of context first. The past 12 months is one that we'll remember for both positive and negative reasons. While the possibility of a pandemic was certainly in the scenario plans of many of our firms, I don't think there's many people who actually thought that it would happen. Very few of us thought that it would in fact be our reality. The pandemic has stretched relationships at many levels, but in other areas, it's actually brought business, industry, research and governments together with a common purpose: to save lives and to save livelihoods. While there are many challenges ahead, many of us are hoping that the advent of a range of vaccines will perhaps stem the damage and enable us over time to start to interact fully again, and for our businesses to invent, invest, trade and manufacture in what we might call a COVID-light world. For many of our clients and colleagues, the issue of vaccinations is raising some very interesting and challenging situations. While most governments are providing vaccinations in priority order to frontline workers and others, in particular segments of the population, we are left sometimes with some dilemmas, perhaps about the availability of vaccinations and how that might proceed amongst our workplaces. Will we be required to have a vaccination passport? How will employers deal with different kinds of employees across many different businesses, different outlooks, different cultures? And what are some of the other issues that might be important here? Today we have a panel of three informed and thoughtful people who've been willing to share their insights and their thinking and some of the questions they're asking themselves too around starting strategies for these difficult answers. But we want to make this a very collaborative exercise and to engage you and your questions. So this is uncharted waters. So please provide your questions through the Q&A function on the screen, and we'll feed these into the panelists as we go through. So over to our three panelists to start the discussion. Dr. Suresh Yadav from the Serum Institute in India, based in Pune, Lee Stewart from Amcor, based in Singapore, and Belinda Dunn from PwC, based in Sydney. But they each are keen to indicate that they haven't solved everything either, and really they're sharing their initial thoughts and the ways they're thinking through things at the moment. And I'll provide further details on each of the panelists as we go through. But we might start with Dr. Suresh Yadav. Suresh is the Executive Director of the Serum Institute of India, based in Pune. It's the world's largest vaccine manufacturer and is expected to produce hundreds of millions of doses of the AstraZeneca vaccine, as well as more than 1 billion Novavax vaccines when that's approved. And Suresh, I think we're very curious. Many of us are working at the other end, if you like, of the supply chain, but we're very keen to understand a little bit more about your work. And if you can perhaps give us some insights into what's different about COVID vaccines, the diversity and their requirements. What's different about it? Then we might get on to some of the challenges around supply chains. I think you're on mute, Suresh, if you could. Thank you.
Sorry. Yeah. So thanks, Marianne, and thanks the NGS Global for inviting me to be part of this illustrious panel. Honestly speaking, I am not used to be a member of a panel where my other colleagues are not from the same field. Usually people from the vaccine field or governments or WHO, UN agencies. So those kind of colleagues I have interacted with. Uh, but here I think it is a very unique experience. But before I proceed further, I think for the benefit of our listeners, I would like to say that the Serum Institute of India is about 54-year-old company. And today we have got almost about 27 vaccines which are WHO pre-qualified. That means we are supplying to the UN agencies, that is UNICEF and PAHO. And we supply to almost about 170 countries. And we claim that almost 65% population of the infants born in the world every year get at least one vaccine, if not 9, which are manufactured by us. So we have been responsible for saving the lives, particularly the measles group of vaccines, measles, MR, MMR, which has saved more than almost 30 million lives so far since we started supplying them to UN agencies in 1994. And having said so, I think coming back to the COVID, uh, although we feel it is a very unique situation, but it is really not new for the world that have faced such a situation in the past. I think the first time we faced such a situation was in 1918 when the Spanish flu came. And that particular pandemic, the Spanish flu pandemic, was so far one of the biggest. 500 million people were affected. More than 55 million people perished. So many suffered. And at that time, of course, there was a tremendous paucity of vaccine. And in fact, since that time, the scientists all over the world were always thinking that if the same situation comes in the future and if we are not ready, we will be affected very badly. And if you see in last, I think 100 years, we have seen several pandemics. The recent ones to talk about was the H1N1, which was originated in Mexico 2009, and they spread almost all over the world. But fortunately for us, the mortality was not very high. The morbidity was there. People suffered from influenza, but then recovered very fast. Of course, there was mortality, particularly even in India, we have seen mortality with H1N1. After that, there was not big pandemics, but there was a threat. When we encountered SARS, then we encountered MERS. Then recently, 4 years back, there was an outbreak of Ebola in Africa, which could have turned into a pandemic, but which was sort of contained in that particular area. But when the COVID struck, say in November or December of 19, uh, the world was only getting very scanty information that some disease has come in Wuhan, in China. People are getting affected due to the lung infection, pneumonia type of infection, but the traditional medicines are not effective. And that was the time where most of the vaccine companies started thinking that if this becomes a pandemic, then we must get ready. And that's how I think something very unprecedented happened. In the past, there were maximum 2, 3, 4, or 5 companies making a vaccine for one disease. And today for COVID, till yesterday's figure, 266 companies or laboratories or universities are developing COVID vaccine. This is totally unprecedented. People wants to develop, but of course, when it comes to the delivery, they have to go to some of the established manufacturer or start their own manufacturing unit to make the product available to the people. And vaccine is something where unless you do complete clinical trials, the product is not available and you cannot make it available to the people. Today, fortunately for us, as on for last 3 months, there are almost about 8 vaccines which has got emergency use license. There are 2 vaccines which has got actually licensed. And another almost about, I think, 30 to 40 vaccines are in pipeline, which may become reality in the next about 6 time, 6 months to a year's time. And these vaccines are very diverse. You have got because there were so many technologies which were developed in last 20 years, but were not put to use for making a vaccine, because nobody wanted to invest in the clinical trials. Because if you have to do an efficacy clinical trial, you have to spend almost about 250 to $300 million to prove that the new product is as efficacious, if not more. And to change that thinking for the existing product, which is available at a very cheap rate and in abundance and is working, no manufacturer was ready to use these new technologies. But when the COVID came, everybody wanted to try the new technologies, the established technologies. So there are at least about 10 to 12 different technologies which are being used. The products are being made. And even today, we have got the products which are from mRNA technology, which are live viral vectors, which are killed vaccines, which are total protein vaccines, uh, and so on. So all these vaccines have different characteristics. Some of the vaccines require very ultra cold storage, -70. Some requires -20. Some can be stored between 2 to 8 degrees centigrade. There is no product so far has been developed which could be stored at the room temperature. There are different ways to administer this product. And recently, the Johnson has introduced product just last week, which is a single dose product. So that is something what the world is looking for. So all other products are required to be taken 2 doses uh, with a difference of between about 4 weeks to 12 weeks between 2 doses, and then population could be immunized. But again, something which is unprecedented with COVID is that COVID has not spared anybody. Whether you are a newborn or whether you are 100-year-old, COVID had struck everybody. So that means if you have to immunize the whole total population of the world, you will have to have almost about 16 billion doses, because today 7.8 billion is the population. And if you require 2 doses, you require that 16, almost 16 billion, taking into account the wastage factor. And that kind of capacity is not there. So one has to really think what should be the priority, how it is to be introduced. And one more good thing which has happened is almost all the governments and the regulatory agencies came together to decide about the pathway to expedite the transition from the lab to the final product. So regulators have gone out of the way to ease out certain restrictions or certain procedures without compromising on the safety and quality. And they have expedited the process so that in almost about, I think, 10 months to a year's time, we have got these 10 vaccines which are got the emergency use license or the actual marketing authorization.
And Suresh, can I just clarify? So that's the COVAX arrangement between countries?
Yes. Yes.
Yeah.
I can just mention that fortunately, I think for everybody, all the members of the world, I will put it that way, almost 192 countries have become member of the COVAX. Now, what is COVAX? COVAX is an instrument or is an arrangement which is formed by the donation which has come from the multilateral companies, from the governments, from EU. So they have got almost about $8.5 billion. And all these 192 countries who have become COVAX uh, can claim their share of the vaccine, which will be procured by the Gavi. So it's a collaboration between WHO, Gavi, and CEPI together. Gavi will be the nodal agency to decide about which country will get the priority, and UNICEF will do the procurement for these countries. And some of the manufacturers have signed with COVAX to supply the product at a particular price. And I'm very happy to tell you that we are the first company, that is Serum Institute of India, who has signed 2 contracts with COVAX for supplying them the AstraZeneca vaccine and the Novavax vaccine, which is still under clinical trial, the Novavax one. But the AstraZeneca has already been distributed and supplied to we have supplied it to almost 29 different countries, either through COVAX or to our direct collaborations.
So basically, the supply chain at this stage is going through governments, through
Governments, that's correct.
with COVAX, right?
Correct.
Thank you. Well, thank you for that. For someone who's used to talking to just virologists and not the rest of us, I think that was a lovely and clear explanation of the variety of vaccinations and the history of things that we have in fact dealt with in the past. And please feel free to come in on any of the other panelists as we go through. But I might go over to Lee Stewart. Lee's Vice President of Human Resources for Amcor Asia Pacific, currently based in Singapore. And Amcor has more than 47,000 employees and is a global leader in consumer packaging across food, beverage, pharmaceuticals, medical, home, personal care products, and I've probably left out 3 or 4 along the way. Lee has led HR for a range of large industrial organisations, previously being based in Hong Kong with Leighton Contractors, Leighton Construction and Mining, and in Melbourne with Visy Industries. Lee, you're dealing with the other end of this situation. It'd be helpful to understand a little bit more about your role, and then what is the thinking around and the nature of discussion in Amcor around vaccines, and perhaps your thoughts on some of the challenges.
Yeah, thank you very much for the introduction, Marianne, and good morning, good afternoon to everybody. It is a very complex issue. It's rapidly evolving. And look, I'm by no means an expert. I think, as Dr. Suresh said, this is unprecedented and uncharted waters for all of us. But to your question, I'm happy to share some of the thoughts and perspectives that I'm sort of seeing from within our organisation and more broadly from those I'm connecting with around industry across Asia Pacific. I think the first thing I'd say is that there is 2 distinct phases in the way that we're looking at this. I think the first phase is where we are today, where there is more demand than supply, and that limited availability creates a situation of scarcity and need, which means that different people are going to get different vaccines at different times. And as a global organisation, that obviously poses challenges for us. The next phase after that will be more of what we are used to dealing with as employers, whereby you have annual vaccination programs, boosters and other things which employers become involved in. If you just think to your own experiences with annual flu shots and the like, and the employment relationship gets involved more frequently in those types of circumstances, but this is a different circumstance altogether. It really does raise a multitude of complex issues for employers, and a lot of them go beyond the employment relationship in terms of the personal choice that goes with wanting to have a vaccine, which vaccine you have, and the time frame and rollout plans with which you will be involved. So as an organisation, the discussions we have largely go to those factors. And I think, Marianne, our starting point is that, you know, it is a personal choice. We will not do anything which will discriminate in any way against anybody who chooses not to have a vaccine. Not only in most jurisdictions is it unlawful to do so, but I think unethical for a lot of employers to be involved in putting in place any policies or practices which could have that implication. Therefore, we would support people in that choice. How do we support them? Then becomes the question. Education and awareness is a huge aspect here. Our experience across emerging markets, which for Amcor is Asia Pacific, obviously, Latin America, Africa, Middle East, these types of regions, often our people look to us as a source of information and a source of trusted information. There is a lot of social media misinformation, and they come to us for a source of truth. So we take that obligation seriously and try to keep ourselves aware and abreast of what's going on so that we can inform ourselves as an organisation on what to do. The second core principle, I think, is that we are not a healthcare provider. We're not a registered medical provider, and nor are we experts, nor do we try to be. And therefore, we are not going to be getting involved in any form of procurement or distribution of vaccines. In each of the countries in which we operate, the nation state, the government, the health regulators will do that. And we will support our people to participate where they choose to do so. Look, that participation could mean that we support them with time off to access to clinics or points of distribution and the like. And we'll support them in any way where they choose to do so. So that's really where the issue is at the moment. It is rapidly evolving. One point of interest is that we've just seen over the past week or two that Indonesia, a market in which we participate, is moving down the pathway of mandatory requirements for vaccines in certain areas. You know, that raises implications for us. And it may be that this becomes an increasing trend for countries where the level of case numbers and community transmission is particularly high. But that's one to watch out for. Maybe I'll pause there, Marianne. They're the sorts of things we're talking about.
Great, thanks for that, Lee. I might just introduce Belinda more fully then. Belinda Dunn is Director of People and Culture Operations and for the professional services firm PwC based in Sydney. She joined PwC in that auspicious time of October 2020, which is an interesting time to join a new organisation, probably any time in the second half of last year. And we certainly had a number of our clients and candidates involved in that situation. Prior to that, Belinda was Group Director for People for Worley, a global provider of professional project and asset services in the energy, chemicals and resources sectors. And at Worley, Belinda led the people function across both the Americas and then Asia Pacific. And so she's also aware of many of the broader issues that we're looking at today. So welcome, Belinda, and perhaps it would be timely to get your perspective then on the nature of discussion that's going on where you mix around vaccines and their deployment and some of the challenges.
Thank you, Marianne, and thanks for the opportunity to join the panel conversation this afternoon. I think as Lee alluded to, I'm keen to be part of the understanding the challenges and the collective thinking on this. I will preface that as you were doing the introduction, in our COVID world, I'm working from home. My Wi-Fi went all funny, so I truly hope I stay clear and throughout the comments. And if I don't, then Ellen just start waving at me and I'll stop talking. So yes, look, I think listening to Lee, following Lee is a bit tricky because I was kind of like, yes, we're very aligned. We are obviously in different industry sectors, and I'm coming from a different geography, now working in a role that's very much Australian centric. But I think the word that he used around complexity is applies across jurisdictions as we all grapple with how to manage our workforces through the transition to a vaccine and getting the vaccine across the communities. The nature of conversations that I'm a part of very much looking outward at the moment and listening to the Australian government position and looking at the early advice that's coming out from our safety authorities, the Federal Workplace Safety Authority, Safe Work Australia. They are starting to publish some quite clear positions around how they're recommending employers approach the vaccinations. As Lee indicated with their position, we haven't yet published a company statement or a company policy. However, certainly the conversations I'm in are leaning towards that we would not mandate vaccines. The Australian government's been very clear thus far to say it will not be mandated in Australia, so it's very unlikely as an employer that we would attempt to be inconsistent with that. But there's definitely a sense of community, I guess, role in the community and our obligation as a large employer and in the Australian market to be supporting, I guess, the sentiment and the recognition that vaccine is such a critical move for the world, as Dr. Suresh highlighted to us, in order to move forward from COVID. So I think we will be positively encouraging, but certainly not mandating nor requiring people to take the vaccine, unless, of course, they work in a sector with one of our clients who is in, for example, healthcare and so forth, that might end up mandating on a sector or a risk-based scenario. So we'll be looking individually around any context that might require vaccine, but certainly the sentiment at the moment is around what information do we need to get to our leaders in order for them to be having conversations with their teams and with their clients in a context of an evolving situation, because we are only at the very start of the vaccine rolling out in Australia, and it's going to be coming along. I think another, probably at the tactical level, another point we're grappling with around is the sentiment with some colleagues that it's not so much concern about coming into the office and working alongside people who may or may not be vaccinated. It's getting to the office, and the fact that the Australian government's been quite clear to say vaccines will not be mandated in Australia is making people still very nervous about public transport. And so as we think about hybrid working scenarios and the ongoing ways that teams connect, it feels at the moment like there's still going to be quite a degree of hesitation with some colleagues to return to the office. And so us continuing to think about how to work virtually and having how to effectively have teams work in an ongoing basis, that we may not in any time soon get significant size full teams back to offices for a certain length of time is certainly very topical for us at the moment. So that's probably the key points. I think, I mean, as I said, it's really around figuring out what the right information is to build our leaders' confidence to manage through. And as it is evolving, it's something that's an emerging topic, and so we can't clearly give crisp definitive guidance as to how to respond and lead through it. But also, I think, similar to what Lee said, we want to be inclusive, and we want to find the way that enables all of the teams to be working effectively together without mandating a move to you must.
Thanks very much, Belinda, for that. It's interesting. We're starting to get the questions in, and they're quite various. The first one is actually looking at sort of prior to vaccination, in a sense. Compulsory workplace testing for COVID is becoming a factor in Europe. Is this the same in the Asia Pacific? Are people required to have COVID tests?
Maybe I could take that one, Marianne. Not to my knowledge in our industry. I've not come across a circumstance where someone is required in a compulsory sense to take a test. That said, I'm sure that there are those industries. I would suggest, obviously, anybody in a frontline response type of industry, there would be. Obviously, travel is one that's going to be in a definite situation. I'm not familiar with any others, though, and definitely not our organisation have we come across any compulsory requirement for testing.
Belinda, any?
The only other observation I'd make is that I know some other businesses, large size firms in Australia, are still doing temperature testing. So there's still very much a temperature checking element going on, but I'm not familiar with mandatory COVID testing.
I remember having that one where they test the temperature of your skin. I was walking up to a medical appointment on a cold day. They tested me and said, your temperature's about 25. And I said, well, I'm not dead. And it didn't go up very much. And eventually I said, well, it's clearly not high, so it's not a problem. And they allowed me to come in.
Marianne, there's one thing I would add, is that I am aware that there is an emerging amount of rapid antigen testing going on in certain organisations, whereby they are being advised that either a direct employee or one of their immediate domiciled family have been exposed to a positive case. A lot of organisations I've been speaking with are undertaking their own organisation-led rapid antigen testing, which is not the full PRC test, but it's an early indicator test. But again, that's not compulsory, that's organisation-led and generally aligned with some form of contact tracing.
And I think that also enabled the construction industry in many locations to keep going, because that was part of the arrangement. And I found it interesting talking with a number of senior HR people in the construction industry, and their view was, well, our people are used to dealing with safety issues, and so that this was all part of the safety package. So I thought that was an interesting situation. Lee, you mentioned the travel, and one of the other questions is around that. Where travel is an inherent part of the role. How do you deal with the requirement for travel? Is that something where your expectation is strongly that if people are required to travel, then they will be vaccinated, or is that something where the airline might require it? Any thoughts on that?
Yeah, look, exactly. It's a really topical question, because we're very keen as a global business to have business travel recommence. Border closures, mandatory quarantining makes it impractical to do so. But where we have circumstances where it can occur, we're very keen for it. The obvious one being, the green lane business travel channel that may open, and then eventually, hopefully, with more vaccines bubbles. The interesting one, though, comes from who will require it in terms of having a vaccine before you can travel. Is it going to be a requirement of the airline, of the immigration and healthcare departments of the country of departure when you arrive? Perhaps. I would suggest yes. Let's see how that plays out. Or is it going to fall to the employer? And I would see that the employment relationship sits well below the others in terms of driving a requirement to be vaccinated before you can travel. But it is a great question. I think most organisations that have any form of international or even domestic travel for business purposes would be asking themselves that question.
Right. And Dr. Suresh, there's a question for you. You might want to comment on that one as well, but an additional question. What's your opinion of organisations taking a herd immunity approach to management of vaccines? That is, once a certain number of employees are vaccinated, then the workplace is safe. If so, what is that number, or is there a percentage?
Honestly speaking, I think that number is 100%. People are talking about herd immunity. Okay, so if in fact I think Sweden did experimented right in the beginning. They didn't go for the lockdown, but they went for the open sort of environment where they expected almost 70% people to get infected and then develop the immunity. But of course, they took a big chance there because there was a lot of mortality in the higher age group. It is very clear in the COVID scenario that even if you get COVID, after about 2 to 3 months, there has been relapse, maybe due to the same strain or due to the mutated strain. Now, there are several examples in UK and in US and in Brazil, or even in India, that the people who have come from South Africa, from Brazil, from UK to India, that new strain and mutant has been found out, and it has affected the people who had already suffered COVID once. That means getting a vaccine for a particular strain is not a guarantee that you will not get COVID again by a mutated strain. And as we know today, there are at least 4 strains which are of concern, the 4 mutated strain. But so far, the vaccines which are being developed and used, they are in a position to neutralize those mutated strain. Of course, the percentage varies. The UK strain gets neutralized to almost about 85%, whereas the South African strain is getting neutralized about 65%. But it is still getting neutralized because the original cutoff time or cutoff limit, which was decided for the phase 3 clinical trial by all the regulators and WHO, was if the product is 50% effective, it should be licensed as a vaccine. So anything which gives you more than 50% effectiveness, that is a good vaccine. But of course, the higher the number of population, when it is immunized, maybe about 70 to 80%, there is very little chance of other people to get the transmission, because the transmission gets blocked because of the vaccination in the population which is already vaccinated. So that virus will not be able to travel through those human beings to the people who have not been vaccinated. So that percentage will definitely go down, but safely WHO feels that it is about 80% vaccinated people can give you some sort of a safety margin, but it's no guarantee.
I think we all get a point for starting with our mute button on. One of the other questions is around some of the different cultural and country issues. Are you experiencing different levels of vaccine resistance, perhaps, or even different timelines in different parts, perhaps, of Asia Pacific, or where you've got broader responsibilities in other countries from your experience?
I think what has happened is, initially when the COVAX was formed, everybody sort of pledged that they will fight the COVID situation jointly. Mm-hmm. Okay. But what happened in reality? I don't want to blame anybody in person, but what experience we have seen that in US, they declared the US first. Okay. Europe has booked at least about 2 to 3 times, and there are some countries who had booked 5 to 6 times the requirement of their total population in terms of number of doses of vaccine from the manufacturers. So there were many manufacturers from whom the countries have booked their quota directly, and still they have become member of the COVAX. Okay, so this equitable distribution thing right from the beginning was little sketchy. And today what has happened is, I think some of the countries, I will say even our own country, thinks that there is a vaccine diplomacy. So today our license is for emergency use authorization license. That is, we can supply only to the governments. We cannot put it into the open market, and it is the government who is deciding how much and to which country we should supply. So that whole COVAX facilities philosophy has come into question mark. So instead of we giving to COVAX and then COVAX deciding to give it equilaterally or equitably to all the countries, including the underdeveloped, developed, and the super developed countries, this has become free for all, where the manufacturer as on today have no control if they have signed with the COVAX facility. But some of the manufacturers who have not signed, they are free to do their business to different countries directly.
Thank you, Dr. Suresh. Lee, with that question, are there different beliefs about effectiveness of vaccines, and are there any, I guess, broader cultural issues that you're seeing and differences in employees in different areas?
Definitely there are discussion around rollout timeframes, which vaccine each country will get, Even within countries, they will likely have differences in the vaccines that are made available to them based on who's supplying first, and then your level of risk, which obviously makes you a priority person. So all of that is there. I think our position at least is having a vaccine, whichever one that is, of the some 200 or so that are in development or manufacturing, is a positive step towards getting the world to a better place. So that's our starting point. The knock-on effect for that, which will, I believe, emerge quite rapidly as vaccine rollout occurs, is this discussion around, is one better than another? Is one deficient? As more variants to the virus emerge, is one therefore no longer at the same level of efficacy as another? All of this will play out, and will play out across all aspects of society and within communities, and it will play out in the workplace. I wouldn't be surprised if we're in a few months' time, having a discussion that goes to this issue, and how do you bring people back to a workplace with different vaccines, perhaps. I wouldn't be surprised if we're discussing that at all, because we just don't know the full impact of the different vaccines at this point in time. Not only in terms of what percentage of critical illnesses they'll protect from, how long they'll keep us protected, as Suresh indicated, and their ability to protect us from variants. All of these are unknown. So I think that question is going to come out in all parts of society. And it's going to be interesting, and this is why I like this discussion around the COVAX coalition, if you like, because without it, we could find ourselves in a position where wealthy developed countries are fully vaccinated and poor countries have zero vaccination, and that is not going to help us globally. So it's just an unprecedented global issue, which we're all dealing with in real time.
Belinda, any comments on that, or perhaps do you foresee any challenges when there was another question around situations where managing employees, where some employees believe that everybody should be vaccinated, that there may be some tensions, I guess.
Yeah, Marion, look, I think that's a real issue that we're going to have to grapple with, and goes back to my earlier point around us currently trying to equip leaders to respond to their team's different perspectives. In the Australian context, we will default back to the Australian community position, which is one of encouragement, not compulsion. So even, if we were in a scenario that we had our whole office vaccinated, where people had to attend the office, they're still going to be moving around the community in a situation of not compulsory vaccination. So for those who have very strong views that it's all or nothing, I think it's going to be a conversation about being able to work remotely on a longer term basis, because I would foresee that it's going to take a while for the Australian community to reach that point of, as Suresh was alluding to, ideal 70, 80, 90% vaccinated. It's not going to be 100%. So, the concept of having, in the Australian context, a whole office vaccinated, I think in a non-high risk industry would be fairly low for the near term.
Mm. And so if I can ask both Belinda and Lee the next question, then I'll come back to Dr. Suresh for what might be our last question. What are the common questions that our employees are asking you? I'm sure there are many, or asking HR departments at the moment. What do you see as some of the concerns of employees, and are there ways in which you're thinking about managing those concerns?
From an employee perspective, there certainly is colleagues who have either personal health reasons to be not willing to have a vaccination, or have personal aversions to such. I think there is that hesitation and waiting for assurance that people aren't going to be compelled to be vaccinated. So I think that's the primary question, and then we get some tactical ones around, will we be offering them in the office, or will we pay for it? Although I think the government's indicated that they're free. And I'm just looking down here at questions that I actually was. And then the point about travel, which we've already covered off as well, both internationally, I think what Lee said around that's quite highly probable from a risk assessment in any case when people are traveling to other countries, but then also with domestically, whether or not the airlines domestically actually in Australia start to look at it. So they're the types of questions we're getting at the moment.
Lee?
Yeah, I think Belinda's absolutely correct in all of those. And I won't repeat, I'd only build on it to say I think that there is, across a lot of our parts of Asia Pacific, the number one question is tactical. It's like, when am I going to get it? And it's very much, we want it, when can we get it? And, you know, therefore we have to be a source of information as it's available to us, we share it. It's actually, ironically, given us such an incredible boost to our levels of engagement with our workforce, because we're having a meaningful dialogue with them in real time. And so it's actually been really positive in that regard. That's what they want to know today. I think longer term, though, they will want to know more around, so what does the new normal look like? And I think that, you know, the only additional thing I'd add is that as an employer, we start to really need to get prepared for that discussion, because remote working, flexible working, hybrid solutions, whatever you want to call it, there will be a greater demand for it that I can foresee coming in the future.
That's, I mean, it's interesting. One of the probably the most popular phrases I've heard in the last couple of weeks is the hybrid working model. And what is the hybrid working model? That now will be how each organisation manages how work gets done and workplace issues. And in fact, are there different capabilities, as Belinda mentioned, how to prepare leaders for a lot of this. And I think that there is that issue around what is it we've learned around COVID times in terms of some of the capabilities for our people leaders that are more important. I mean, people leaders at all levels, and being able to manage that process. One question, another question that arises is, what sort of data will you be keeping on people, do you think, or what sort of information do you think an employer, I'll keep it vague here, an employer would be wise to keep in relation to the vaccination of their employees?
Well, we do, yeah, we listen to the privacy legislation and the privacy obligations and the, what do you call it, the GDPR that sort of infiltrated the whole world from a privacy perspective. So we would look around a role obligation. So only if people were traveling internationally, for example, and it is decided that you need to have it in order to travel, then we would retain that information. But certainly, I don't believe we'll be looking to hold anything on file unless there is a risk-based obligation on us to do that from the perspective of privacy.
Lee, is that?
Oh, look, exactly as Belinda indicated, I think is the way that we would approach it as well.
Great, thank you. Dr. Suresh, there's a question for you which I think is on all of our minds at the moment. When do you think the global population will reach a level of vaccination where we can return to a somewhat normal world? Next year? The year after?
Again, as I told you right in the beginning, that the total number requirement is so huge. So if you want to see the world going back to the level where we feel comfortable, so even if you consider the population of 7.8 billion, and even if 70% of that is to be immunized, then almost about 5 billion people needs to be immunized. That means we will require almost about 10 billion doses. Now, to have those 10 billion doses is going to, with the present production capacity and capabilities, according to me, it will take at least 3.5 to 4 years to make those many doses available. So it's not going to be very early, but at the same time, I think when we talk about vaccinating the employees, it's not only the employees. We have to look beyond. You have to look at their families. Because if you immunize your employee, but if he gets infection from somebody in the family who caught it, because they are also moving out, then that infection can come back to the workplace and again create problems for the working environment. Fortunately, in India, most of the pharma companies or pharma industry was working. They were not stopped even during the COVID lockdown period. So everybody had their protocols where people were coming, they were tested every day before entry, temperature and the normal cough and cold. And once they are cleared, then only they could enter and start their working. But to ensure that they are continue to remain in that position, unless the whole family is immunized, cannot ensure that. And one thing which every government has ignored, including WHO, is that they have given this priority that first the frontline workers is the medical, paramedical staff, second is the security staff. But those guys who really helped the commercial wheel running at that time were the grocers, the vegetable vendors, and the chemists who kept the things on. And those people and the banking people, the banks were on. But these people do not find their name in the first list of priority list as the people who should get vaccinated. I think this is something which needs to be done, and I request my other colleagues to take up from their companies or their associations to ensure that these people get immunized first.
I think one of our colleagues, I think Julian, shared with us that in China, certainly abattoir employees and all food service, the food development employees were really seen as frontline as well. And I found that was really interesting. And then in some of the developments happening in some countries, while the frontline employees might be vaccinated, as you've mentioned, it's their families also that need to be vaccinated. It's like a total ecosystem there. I think that's a really interesting development. Before we finish, I'd just ask if perhaps Lee might like to make any final comments or anything that he would like to share before we finish, or things that we perhaps haven't covered that we should have.
Oh, well, firstly, I'd say it's been a great discussion. So thanks for that. No, look, there's not much else I would add. I just think if I go back to, the role of the employer in the way that I think we should look at this upcoming period is just stay connected with your people and keep the dialogue really high and don't make assumptions and find new and innovative ways to support them. I think the employment relationship becomes more important than ever. It's going to be challenged to find new ways. But what I'm encouraged by is what I've seen since March of last year is that we've found ways and we've continued to operate, and not in all industries and sectors, of course, but in a large proportion because we've been prepared to work in new ways with our people. So I think that's the key message that at least I'm encouraging my people to think through.
Belinda?
Yeah, look, again, probably something similar to what Lee said. I think it's been a great conversation. It's such a fascinating topic because it is completely global and completely impacting everywhere, and then we're translating it down to our micro units. And I think that's just, it is a moment in time that's pretty unique, and hopefully, although Suresh did remind us there's been other pandemics around the world, but hopefully we don't have too many more of this scale anytime soon. So thanks for the opportunity to join the conversation.
Thank you. And I might hand over to my colleague, Alok Tripathi, who's based in Delhi, a managing partner for NGS Global, to perhaps share some of his insights or learnings from our discussion.
Yeah, thanks, Marianne. Thank you all for some wonderful insights about the background, starting with Dr. Suresh Jadhav. That was very informative, getting to know how we have dealt with pandemics, what are, the implications, etc. And in fact, even as people get optimistic, the reality that how many billion doses we need, hence, what's the practical way to look at it. I think each country is still, in a phase where they are finding their way around the pandemic. And like Lei pointed out, there are two phases. The first phase is where we are, where demand for the vaccine is higher than the supply. And this is where governments will always play a major role. And that is where the role comes in fact. And to their end, in fact, governments have been proactive in expediting approvals for vaccinations, for vaccines to be used for people. And also, in fact, if I give an example of a country like India, where, cold chain infrastructure is also a big reality. So currently we do have about approximately 4% of population that's covered by the universal immunization program, which is for, the pregnant, the ladies and for the infants, for the babies. Now, that is still something which covers about only 390 million of, let's say, the doses. But, at the same time, what we need to understand is we are a country of 1.3 billion, so we need a lot more scaling up in the infrastructure. So what is it that, the private sector can do? I think to start with, perhaps, providing some advisory around infrastructure, how to scale up the infrastructure, how to look at perhaps volunteering, looking at sharing the financial burden in some of the countries like ours, where, instead of, offering it for free, there can be a significant amount that can be paid for using the CSR funds. While these are still debatable and still early stages of discussion, these can be something that can be looked at, and look at, some basic logistic support, like, providing transportation for employees to go to the vaccination centers and coming back. And there are certain industries, of course, that need it on priority, which are more front-ending and facing, which have been more impacted by the pandemic. So perhaps, that also is something that needs to be done. Overall, I would say that, in terms of implications, we do have, when you look at globally, mobility of the workforce, mobility of your labor from one country to the other, one office to the other. Do you need to have, let's say, a universal or let's say a health card or something like that, some identity which proves that, the person is vaccinated? Or, how do you look at workplace going forward, looking in the future, remote versus in-office working? So what is right? What is that hybrid? What is that mix which works best for a particular industry, for a particular employer? So these are some of the calls. And then wellness, overall, wellness has started becoming a more and more important factor as people start working remote. So how do we look at wellness? So each company perhaps review their policies, look at, how best to approach it. And I think that would be it from my end, Marian. Very insightful session. Thank you to all the panelists.
Thank you. I might just hand over to my colleague, Julian Buckridge, based in Shanghai. Thanks, Julian.
This is an easy task. I'd like to thank the unsung heroes, Alistair Young and Ellen Sparks, without whom this technology would not be working. Thanks for putting it together. I'd like to thank Sumitra Agarwal, Managing Director of NGS Global India, for bringing this idea to the forefront, and his colleague Alok for giving us that summary. And then Dr. Marianne Broadbent, of course, excellent chairmanship as usual. Thank you very much. Dr. Suresh Yadav, thank you very much for sharing all of your insights and the power of vaccines and how many lives they've saved. Lee Stewart, thanks for joining us from Singapore. Great to see you again, and thanks for sharing the insights of learnings from AMCOR, given your substantial Asia-wide experience. And also thank you very much to Belinda Dunn for joining us as well. Thank you, everybody, and well done.